Hello everyone, thanks for joining us on TVC News at 1, which will include news from the states. So we'll bring you just breaking news from around the developments from the 36 states of the Federation. But let's begin with the trial of Nnamdi Kanu, where Justice James Omotosho of the Federal High Court in Abuja has given the leader of the indigenous people of Biafra till next Monday to open his defense in the terrorism charges against him. The judge fixed a new date following a complaint by Mr. Kanu that his former lawyers, led by former Attorney General of the Federation, Kanu Agabi, had not released his case file to him for study. Senior reporter Celestina Area has details.
At today's proceedings, no lawyer appeared for Mr. Kanu. Mr. Kanu, who entered the dock with a bundle of documents, announced his appearance for himself and informed the judge that his legal team, which was sacked on October 23rd, had not released the case file to him. He noted that he was constrained to ask for an adjournment to enable him get the case file and study it in order to prepare fully for his defense. He also stated that he intends to call 23 witnesses from within and outside the country and also call to issue an order directing the Department of State Services, DSS, to permit the foreign witnesses to access him. Additionally, he asked the judge to order the DSS to allow his lawyers to have access to him, which was promptly granted. At this point, counsel to the federal government said Mr. Kanu's complaints were strange, noting that he had been in court for hours with his former lawyers. Adegboyega Owomolo, senior advocate of Nigeria, also reminded the judge of the 6th day granted to Mr. Kanu to open or close his defense and urged the court to strictly adhere to that order. Justice Omotosho, in a brief response, said he was mindful of granting an adjournment because Mr. Kanu's claim of not having access to his case file. The judge added that the allegation against Kanu Agabi for withholding the case file was strange and difficult to believe, but he said he will oblige the defendant with an adjournment. He, however, warned against undue delay and wastage of judicial time, noting that several other cases had suffered postponement because of Mr. Kanu's matter. The judge fixed Monday, October 27th, for the defendant to open his defense. Celestina Area, TVC News, Abuja.
In a related development, an activist and former presidential candidate, Omoyele Sowore, has been rearrested after he was granted bail and other protesters by the magistrate, Abubakar Umaru Said, of the Magistrate Court sitting in Kuje, Abuja, with a sum of 500,000 naira. He will be arraigned on another charge on Monday before a judge of the Federal High Court, Abuja. The magistrate also granted bail to Aloy Jimako, one of Nnamdi Kanu's disengaged counsel, and 11 others. Mr. Sowore was arrested by police on Thursday, shortly after leaving the premises of the Federal High Court, Abuja. The court had remanded Mr. Ejimako and 11 others for inciting public disturbance during the protest. The 13 defendants were arrested on Monday at different locations in Abuja during the protest. As part of the bail conditions, the magistrate ordered that the defendants present a verified national identification number. They were also asked to submit 3-year tax clearance certificates and passports. And to security matters, where the Nigerian Army has intensified its nationwide counter-terrorism and anti-banditry operations, killing 8 terrorists and arresting some suspects, as well as rescuing 15 kidnapped victims from various hideouts. Army authorities explained that the operations also led to the recovery of a large cache of arms and ammunition, including assault rifles, improvised explosive devices, and communication gadgets. In the northeast, troops of the 81 Division Task Force Battalion at Gajibo in Borno State repelled an ISWAP terrorist attack, killing 2 insurgents and recovering rifles, explosives, and other items. In another ambush at Wunje village in Goza local government area, Army authorities confirmed that 4 terrorists were killed, while others fled. Similar operations in the north-central region saw troops of Operation Enduring Peace and Wellstroke kill 2 kidnappers in Plateau State, rescue hostages, and recover firearms, ammunition, ransom money, and other materials. According to a statement by the Nigerian Army headquarters, the operations were conducted in collaboration with other security agencies, ensuring effective intelligence sharing, and tactical precision. Away from security to health matters, as the world marked World Polio Day 2025, health professionals in Adamawa State have joined the global call to sustain the fight against polio, calling for a renewed commitment to protect every child from the disease. The event, marked by a symbolic road walk across major streets in Yola, the Adamawa State capital, drew health officials and development partners as they emphasized the importance of vaccination and vigilance in keeping Nigerian polio free. The World Health Organization Regional Director for Africa, Dr. Mohamed Janabi, in a written address, praised Africa's progress toward a continent free of polio. And also, the Adamawa State Ministry of Health, representatives from the WHO, and health workers emphasized that the state remains committed to protecting its children through continuous routine immunization and prompt response to any health alerts.
Ending polio in Africa is about more than halting transmission. It means strengthening the system, workforce, and networks that sustain immunization, outbreak preparedness, and resilient health services. The task ahead demands continued commitment, adequate financing, and coordinated action at every level. On this World Polio Day, let us renew our determination to reach every child with every vaccine, everywhere, and to consign polio to history forever.
And joining me now is a consultant public health physician, Professor Alera Roberts. She joins me virtually. Good to have you join us.
Thank you for having me. How are you?
Very well, thank you so much. Professor Roberts, the theme for this year is End Polio, every child, every vaccine, everywhere. But just looking at that, we know there are a lot of controversies when it comes to the vaccine. How close are we to achieving this?
Honestly, we're closer than we ever were in history, with only the wild polio virus being circulating in 3 countries, Pakistan, Afghanistan, and of course Nigeria. But we've had our polio-free certification since 2020, and this is a major victory for us. But we have to realize our task is not finished. We still see outbreaks of the circulating vaccine-derived polio virus, particularly in the cross-border states in the north, and this is where we need to put in a lot of work.
And Professor Roberts, one of the greatest challenges to polio eradication is the vaccine misinformation and conspiracy theories, and even from global organizations and leaders. How can we tackle this in a way that encourages parents to get their children immunized?
It's unfortunate, but the truth of the matter is that this the vaccine hesitancy will exist for as long as there's misinformation and for as long as there's no trust in public agencies and public systems. So we must first rebuild that trust, literally person by person, community by community, through health workers, through the traditional leaders, through faith institutions. We must all work together to make sure we become the trusted messengers that can speak the language and the values of the people that we serve. Because until we have that trust, there's always going to be that fear. We need to be able to respond to people's fears with empathy, answering their questions, addressing their concerns. Like I tell my students in the class, there is no stupid question. The only stupid question is the question you did not ask. So no matter what they are asking, no matter what their fears and concerns are, we must respond. Very often you find that people are not anti-vaccine as such. They're being cautious. And this is something we have to realize, that science must develop a human face.
Interesting you mentioned that, and that's a takeaway for me. Science must develop a human face, especially when you look at what happened during the COVID-19 pandemic, where there were a lot of questions, but without answers from the vaccine developers. And I'm just wondering, again, WHO has been robbed of poorly by the COVID-19 pandemic, and I'm wondering how it fits in now into this particular, the eradication of polio, as well as UNICEF, and how they can continue to support Nigeria's post-eradication surveillance.
To be honest, there are three things that we need. We first need strong surveillance systems. We've got a strong surveillance system. We must not rest on our oars. We must give kudos to the N500, the Nigerian Field Epidemiology and Laboratory Training Program, that has been training the professionals that have been maintaining it. But it needs to be supported every which way. We need to retain, we need to remunerate, we need to continue training. The other thing is, of course, that segues into health worker training and logistics. We must provide fast and furious health worker training and logistics. We must realize that our greatest asset in keeping this polio-free eradication is going to be healthcare professionals, everybody. And of course, we now need to integrate what we call polio assets, community mobilizers. We need to have a cold chain that works. And that means, in all its entirety, people to actually keep the vaccines frozen and transport them from storage to use to the point where they're used. We need data networks. So again, we need to keep talking to the telecoms people that they need to provide those data networks and make sure they're working. And then we need to have what we call a broader integration into routine immunization. That integration will continue to protect the gains we've made and to strengthen our entire primary healthcare system.
And we hope that the immunization process also wears a familiar face, so that faces that people can trust and listen to. Thank you so much for your time. A consultant public health physician, Professor Alera Roberts, always a pleasure to have you on. Thank you.